Welcome to Canon Psychology Continuing Education. I'm Cassandra Cannon, a licensed clinical psychologist. I'm also an EMDR approved consultant, and I'm also an approved sponsor by the APA to offer continuing education courses. And one thing I wanted to talk about today is the importance as an EMDR clinician of understanding the whole picture of your client who wants to do some addiction recovery treatment with you. And what I mean by that is if you're not very familiar with addiction and recovery in general, you might miss some pretty important pieces. And one being understanding some cultural aspects of addiction recovery. One thing to note is that some individuals come to you and they are looking for complete abstinence from either their substance of choice or their problematic behavior. There are some things that you cannot be abstinent from, like eating. You have to eat. So then there are times where your treatment plan needs to be around harm reduction. And something to know in the general field of addiction recovery is some people have very strong feelings about abstinence versus harm reduction. And you don't need to take a stance either way, but you need to understand that, let's say, if your client is really involved in 12-step, then very likely the stance is going to be abstinence. And if your client is going to something like smart recovery, then it's more likely to be harm reduction. And so whoever you're working with, there's some things you're going to need to understand before you engage in EMDR treatment. One, are they a part of a support group? That's really important. I highly recommend that. Some people do not like 12-step. There's lots of other options available out there. Though I will say that 12-step is most available. And if your client is having a really difficult time on Christmas Eve, say, there's probably 15 groups going on at any moment. So that's one thing that 12-step has going for it is access. So again, knowing, is your client a part of a support group? If they're not, highly recommend it. If they are, which one? And understanding the culture. Are you interested in abstinence or harm reduction? In my experience, there are certain scenarios where abstinence really needs to be the case, and your client has not necessarily come to that conclusion yet. And when I say needing to be the case, especially when they are so engaged in their addictive behavior or substance of choice that it is destroying their lives. They're losing relationships, jobs, finances, all of that, because their engagement in their substance or behavior of choice is that out of control. Some people decide to do abstinence for a period of time and then reevaluate and see if they can do harm reduction. What harm reduction means is how often can you use your substance of choice or engage in that problematic behavior without it causing problems in your life. And again, this is a very, very emotionally laden discussion that if you're in the field, people have very strong feelings about that. So just be mindful of that. Also something to note, if your client is, their substance of choice is an opiate, like heroin or pain meds, a lot of psychiatrists or physicians may offer maybe Suboxone maintenance. What that means is they would be taking Suboxone prescribed for long-term period. And a lot of people will say, I'd rather my client be alive and on Suboxone maintenance, which some people may consider a crutch. I'm of the feeling I'd rather you be alive and be on a crutch for however long you need it, however long that is. So know those things. And some other important things to understand if you're not very familiar with recovery is if your client has decided to engage in 12-step, it's really important to know what step they are, because the fourth step is that um, inventory where they are going through their lives. It's a fearless inventory, and a lot of people relapse at the fourth step. So know that as well. Other things to know are in what ways is this interfering in your life? Some people are coming to me saying, I just think I might have a problem. And so their treatment plan is going to be different than the person who has already lost their family, their job, and their doctors are telling them, if you don't turn this around, you're not going to be here much longer. So the treatment plan's going to vary. Now, when it comes to applying EMDR, that it's also important to make sure that they're ready for it. And I go into a deep dive with that in my continuing education course called Applying EMDR to Substance Use Treatment. And that's a 2-hour course that's EMDRIA and APA. So you get 2 credits for both EMDRIA and APA. And in that course, we not only talk about client readiness to engage in EMDR, but also where are they in their level of motivation for recovery. We go deep dive all in that. And I also have handouts that you can download from my website. You can go to I think it's called tools, like therapist tools. On that, it takes you to my Thinkific platform where you can download a free EMDR readiness guide for substance use. And then I also have, stages of change and in EMDR interventions that are appropriate for which stage of change. And this is all from my own personal experience as a clinician working in residential and outpatient treatment. Something else that we'll be doing a little bit later in some other YouTube videos is, do you do standard protocol versus which addiction-focused protocol you should use when? I go a lot into that in my CE course, but I wanted to do a little quick YouTube, and I'll do another one on specifically people show up on the EMDRIA listserv all the time saying, what do you think about this protocol versus this protocol? And the answer is, it depends on what your client needs, because each protocol has different qualities to it, and it's really going to depend on what your client's problem is. So I hope this kind of overview was helpful for you in just, even if you're getting your feet wet in helping clients with substance use treatment. One thing that's really tricky is when you have a clinician doing something that might get in the way of maybe what your client support system is trying to help them with. And so you don't want to conflict, you want to work with them. So understanding, is your client attending support groups? Are they not? What's their attitude towards that? Do they have a sponsor? Are they in 12-step? What step are you on? Are you making amends and you just had a really bad blowout with someone you were trying to make amends with? So you need to be working with them and on the same page as to where they are in their recovery. So I hope this is helpful.